Madeline. I'm going to be your nurse today. Could you just please confirm your name and date of birth for me?
Yes, Jaden Smith. My birth date is June 6, 1942.
Awesome. All right, everything matches. We're here today because you booked an appointment for a new complaint and you wanted some education on your previous medications. Is that correct?
That's right, I take lots of different medications.
Why don't you actually first tell me about the tingling and what has been going on?
Yeah, it's been weird. I have this tingling in my feet. It's been like, I think, a couple months now, and it makes it hard for me to walk around the house.
That might be some neuropathic pain, which would make sense due to your medical history.
Yeah, I have a lot of stuff going on.
So why don't I go through those really quickly though, so that we can kind of analyze those and the medications and side effects that might
lots
be
of
leading.
pills, lots of things.
So let's just go down the list, and I'm also just going to be kind of telling you a lot. I'm going to be saying a lot of information to you.
That's right.
Okay, I'll also be giving you this brochure that I made.
Oh, great.
So it'll be typed up.
So I can leave with that?
Exactly. All right, so the first thing that I have here is that you have type 2 diabetes. Is that correct?
Yeah, unfortunately.
It says here that you take metformin for that.
Yep,
Glucophage.
that's the name. Yep.
Which is in the biguanide class, which is like the first line medication. So basically what this does, I'm just going to kind of give you some education of what the drug actually does in your body for each of your meds. So it basically lowers your liver's ability to make glucose and increases the insulin sensitivity. So it helps just kind of regulate your insulin and glucose levels. It also has minimal side effects. So a lot of patients with type 2 diabetes are on it. There are a couple things that nurses should kind of take to consider when taking the medication. You should take it with meals. You shouldn't stop taking it abruptly for any reason. You should also be assessing your skin for eczema or rashes, which would be indicative of like hypersensitivity or that you're having some sort of reaction to the medication. And then you would want to make sure that the medication is doing what it's supposed to be doing in your body. So it's recommended that to test its measure of effectiveness, you would get your A1C or like your blood glucose levels checked. Since you are 79 years old, there is an increased risk with patients who are 80 years old and older at developing lactic acidosis. Also can increase your risk of chronic heart failure or increased fluid retention, which are contraindications of the medication. Alrighty, so next thing is hypertension.
Yeah, my blood pressure. It's been high for a long time.
Okay, and you say that you're on captopril?
Yeah.
Specifically lisinopril?
That's the name. I'm pretty sure, yep.
Yeah, so that is it's called an ACE inhibitor, and
Yeah.
ACE stands for angiotensin converting enzyme. And basically, the way that the medication works, it stops the conversion of angiotensin 1 to angiotensin 2, which leads to your body to have vasodilation. So it prevents those vessels from constricting so that you can open and reduce your blood pressure. It's very well tolerated as well, and it's also widely used. It's also used for multiple diseases, so it'll also help with your diabetes and a post-heart attack. So there are multiple benefits to taking this medication, which is great. As for nursing considerations, you want to be monitoring your blood pressure, of course, assessing for a persistent cough. You want to also be reducing salt in your diet. The nurse should also be monitoring potassium due to hyperkalemia. Obviously, we would want to see a decrease in your blood pressure. And then lastly, as for age considerations, overall this medication is pretty widely used and pretty easily absorbed. The only contraindication is your heart has been pumping for 79 years. So
sure has. It's been pumping. Yep.
So it might be a little more tired. And which may just lead to some alterations with the dosages. It says here in your chart you have hyperlipidemia.
Food, I eat, yeah.
And for that you take atorvastatin, which is like Lipitor.
Yeah.
An HMG-CoA reductase inhibitor. What it basically does is it stops the CYP system, which carries a lot of enzymes from synthesizing cholesterol. One of the most widely used statins out of all of them for hyperlipidemia. And it's very It works very well at decreasing total serum cholesterol. It's also very well tolerated with minimal side effects. So the nurse should be monitoring for GI effects. If you were taking any antacids like Tums, or I think you're on Mylanta,
Occasionally.
you would want to just make sure that you're taking that either 2 hours before or 2 hours after taking your Lipitor. And the nurse should also definitely be watching, slash you should be watching, if you notice any muscle weakness, or if your urine starts turning the color of Coca-Cola.
That would be a problem.
That would be a problem. That you should definitely contact.
I would call.
Good.
I would call.
It's a possible rhabdomyolysis. The nurse should be checking, obviously, your total serum cholesterol, so your HDL, LDL, your triglyceride levels. Just as for your age, like younger adults, I'm sure you did this before you were prescribed, but diet, exercise, and weight control should be kind of the primary way to treat hyperlipidemia. Next thing that I noted is you had a heart attack, and for that you take clopidogrel, Plavix, which is a adenosine diphosphate receptor antagonist, phenylpyranine, and it basically prevents blood clotting.
That's good.
Yeah, it's very good. It reduces the likelihood of another heart attack or stroke or ischemic event of any sort. The nurse should be monitoring for bleeding, monitoring your liver functions, and being aware of the medications that increase and decrease the effectiveness. You want to check the hemoglobin and hematocrit levels and assess for absence of vascular events, so ischemic events. So obviously, no events is good news. Adults are more likely to experience bleeding. And then on top of that, for your heart attack, it says here that you take aspirin.
Yeah.
And that's acetyl salicylic acid, or an ASA. Basically, that stops platelets from sticking together and prevents future clots. So it works in combination with clopidogrel often to really make sure that we are not generating any new clots to lead to possible ischemic events.
That sounds like a good thing.
It's a great thing. And aspirin, in addition, is especially beneficial with patients with AFib, which I also have in your chart that you have. The nurse should be taking account of, ensure that you're taking it with food or right after meals. Again, watch for bleeding or hearing loss. Avoid aspirin for approximately 2 weeks before or after surgeries, again, just due to bleeding. No news is good news in terms of events, but also we might look at your PAI, which is your platelet aggregation index, to see your platelets are doing in your body and whether they're kind of combining or not. The Beers criteria states that when over 75, aspirin, as I said, can increase GI bleeding and peptic ulcer disease. Going down the list, we're just cranking this out.
That's good. I'm learning a lot. Thanks for all your time and educating me about all these medications.
Of course. Well, this can get really lost really quickly when you get prescribed medications.
It's true.
It's easy
I
to
didn't
just
know all
be given
these details.
medications and then thrown out the door. All right, next, which you've mentioned a couple times, is your chronic lower back pain.
Yeah. Oh boy. Yep.
And it says here that you take tramadol for it.
Yeah.
Ultram. Okay. Which is an opioid agonist.
Yeah. Yeah.
And it binds to mu receptors, which is a type of receptor that opioids bind to, which stops serotonin and norepinephrine in the brain from transmitting those pain signals. So that's what it's actually doing in your body. And we usually prescribe it. It is an opioid, but it's very well tolerated in older adults, especially those with back pain, fibromyalgia, and actually neuropathic pain, which you mentioned earlier.
Mm-hmm.
And it also has low potential for abusing the drug, and so it's really good for like long-term management for chronic issues. So you also want to make sure that you are avoiding concurrent use with benzodiazepines, because that can definitely increase your risk of falls or feeling really out of it, sedated. You also want to make sure, like basically all your medications, not to stop abruptly. Can really make your body confused.
I follow the instructions and I do my stretching.
Perfect.
Good.
And to watch for respiratory depression or dependence on the medication.
Mm-hmm.
You would want to see if this medication is working by using a pain scale, checking in on how your pain is doing, and Due to your age, your dosage may need to be increased or adjusted due to renal or hepatic impairment that just happens over the years. Alrighty, next thing on my list is you have a history of migraine.
Yeah. Oh, the old noggin. It's like knocking on the noggin.
Okay. Sorry to hear that.
Yeah.
And I hear that you take naproxen.
Yeah.
Or naproxen or
That's the
naproxen
name of it.
sodium,
Yep.
which is a non-steroidal anti-inflammatory agent. Basically what it does in the body is it destroys inflammation cells, and by stopping prostaglandin synthesis of your COX-1 and COX-2 inhibitor, but basically its job is to just reduce inflammation. And it's rationalized by being just a great treatment for migraine headaches due to being specifically like really good at quick absorption. So, right when you feel one coming on, you can take it. Or your nurses should be thinking about taking it with meals to prevent GI upset. You also want to be checking for bleeding and be cautious when administering to patients who have cardiovascular events and hypertension. So just be extra aware of possible GI upset or bleeding. We would probably check the effectiveness on the medication by using a pain scale. You would want your migraines to be going away in about an hour once you start the medication. And older people should not be taking more than 200 milligrams of naproxen every 12 hours. Next on my list, I see that you have atrial fibrillation.
AFib, yep.
Yeah, amiodarone, which is a class 3 potassium channel blocker. And basically what it does is it just slows down the heart rate by blocking the potassium channels to slow down the repolarization and onset refractory period of your heart. Treats atrial tachydysrhythmia. You should definitely be checking the heart rate and blood pressure before giving it. Take it with food and don't drink it with grapefruit juice. You would want to check heart rate to measure effectiveness. It should be lowered and dysrhythmia should be resolved by taking the medication. Something just with age is your absorption and elimination could be variable, but there are severe adverse effects that could definitely be heightened with age. So of course, just reporting anything that's abnormal is just two more here. It says you have a history of acid reflux.
Yeah, a little bit.
And you take Mylanta for that, which is an antacid, which basically just neutralizes your gastric acid in your stomach with alkaline substances. And so this is another widely used medication, which is why it was prescribed. It's used for many GI complaints. You should be taking it 1 to 3 hours after a meal. You also should be aware that some drugs such as anticholinergic and cholinergic drugs may impact effectiveness, and benzodiazepines, corticosteroids, and digoxin, which is another heart medication, can cause toxicity. You would want to check to make sure that it's working for decreased GERD, decreased acid reflux, and possibly you could assess the pH of your stomach. Older adults may need less dosage-wise compared to younger adults, and also with decreased renal function, they are more likely to experience adverse effects, as with every medication. And then lastly, I just wanted to briefly touch on your tingling. Yeah. I think that is definitely some neuropathic pain, which could be coming from a variety of your issues, possibly diabetes. But I think I'm going to put you on gabapentin, which is a neurontin. Gamma-aminobutyric acid structural analog, and it binds to areas in the brains with high affinity for gabapentin and stops postsynaptic responses. It's used for actually seizures, specifically absence seizures, or to improve neuropathic pain. But something you want to be cautious of is definitely take it with food. Don't stop it abruptly. Two normal ones. And then one specific one is to be cautious of suicidal ideation. Again, we would want you to have an absence of neuropathic pain. And due to your possible renal impairment due to your age, the dosage may need to be adjusted accordingly. But does that sound like everything? Did we cover everything in your medical history?
Yeah, based on my little scribble note here, you've covered everything, and I've learned a lot. So thank you.
Of course. Well, I hope that this little education system was helpful for you. Obviously, if you have any questions at all, or if anything comes up, or you notice any of these adverse effects as I just noted, please don't hesitate to call.
I know where to find you.
Alrighty. Have a good day, Mr. Smith.
Okay, thank you so much.